What's up, guys? Today we're going to talk about fibromyalgia. So again, this is a pretty common one that you're going to end up seeing in the clinic, especially if you're working just regular outpatient ortho and if your clinic has a pool. So let's start talking about it. So a big thing anatomy-wise is really just understanding that it's going to be a rheumatological condition. So it's going to be diagnosed through a blood test. I think I kind of forgot to put that on here, but it's going to be diagnosed through a blood test as well as these specific trigger points. So there's like tender points in the body. That's how the patient is going to be diagnosed. It will have to be by a rheumatologist, though. So it is a problem with the nervous system's response to stimuli. So similar to chronic fatigue syndrome, just the mechanism is a little bit different because we have this biologic factor going on with it. Again, the musculoskeletal system will be the big thing going on with this patient, the specific trigger points. And because it's a myalgia, myalgia means muscle pain, the patient's going to have issues with their muscles and over fatiguing the muscles. So what's the etiology of this? So not one true etiology has been confirmed. It is more common in women between the ages of 14 and 68 years old. So women are more likely to be diagnosed with this. We can get into a whole spiel about why. I think it's problems with our healthcare system, but besides the point, that's what the boards want you to understand. And then also understanding that it is more common in women of color versus white women. So just keeping that in mind as well. But mostly just focusing on the women aspect is going to get you like 90% of the way there. Could be related to diet, could be also endocrine disorders, so hypothyroidism, diabetes mellitus. Others could include hypercortisolism or other problems with the patient's ovaries and their ability to produce estrogen, their testosterone levels. Could be a bunch of endocrine problems. Trauma/injury ends up being a big one. So a lot of patients who've been in some sort of accident or had some sort of trauma to that area ends up manifesting as fibromyalgia later on. Genetics tend to be a big component as well. If your family member had fibro, you're more likely to get it. That's pretty much just what that's saying. And other work-related/environmental factors. So being in a job that's going to over fatigue you, causing excessive muscle pain, like a very heavy-duty physical job. Other environmental factors, they're still trying to figure out specifics. So like, chemicals or like other things that are going on in the environment or different exposures. But that's kind of what could potentially happen with this patient. So no true etiology. Really big thing to pull from this, women. So what does it look like? This is not chronic fatigue syndrome. So I have a separate video on that, but this is not chronic fatigue syndrome. That's a separate issue. We're not going to discuss that. Even though the treatment for both of these is very similar, the etiology and the presentation is different. So again, pain at 11 of those 18 trigger points as identified by the American College of Rheumatology. Now that might have changed since this. They're not going to say like, the boards will not ask you a question, or at least they shouldn't ask you a question that's like, the patient has 8 of the trigger points. Is that fibro? Like, because you're not diagnosing. Just understanding that there are these trigger points that the patient is being poked at, which are these trigger points right here in this video. So if you can see the video, that's what's going on there with these patients. And so if you're feeling pain at those trigger points, that's how they diagnose it. They'll also do blood tests, test for rheumatological factors, similarly to how they test for rheumatoid arthritis and like lupus and other diseases. They will do blood tests as well to help confirm this. A patient will complain of the following symptoms. So the increased fatigue, the muscle pain, headaches tend to be a big one. They'll get chronic migraines that require them to be laid up for a while. They could present with possible mood disorders. So what does this include? Like anxiety and depression and those sort of things, and difficulty sleeping and insomnia. They could also present with abdominal cramping, which could manifest as like IBS or something like that. And then just in general, they'll have pain throughout their body in various different areas, not just in the muscle. So how are we treating it? This is a big one where you're going to validate the patient. I think a lot of people skip this step and they just try to go straight to treatment, or unfortunately, a lot of these patients just get written off as, oh, these are chronic pain patients. They're just always going to be in pain. I can't fix them. And then people go into this giving up on them. The important thing when you have patients who have like fibromyalgia or even chronic pain disorder is understanding that you just being there to help work with them is going to improve their quality of life. It's not going to solve the problem. I think a lot of times we think that we're going to fix a patient. This is not going to fix the patient. They have this. This is something they're going to have to live with for the rest of their life. And the thing about physical therapy is we're trying to decrease their symptom levels to a level where they can enjoy their life, have good quality of life, complete their work-related activities, hang out with their grandkids, whatever they want to do. That is the most important thing. So again, just get it out of your head that it's not your fault that this patient is not being fixed. they won't be fixed. We're just trying to help them have a better, higher quality of life. So validate that the patient probably feels like trash. That's a big thing. It builds rapport with the patient, and then they're happy that you believe them, and then that like actually will decrease their pain because they won't get anxious about it. Dual tasking is really good with these patients and also the chronic fatigue patients, so it distracts them from their pain. So, for example, if we're doing aquatic therapy with the patient, just talking to them gets them to not focus on their pain as much, gets them to do more activities, which is good for them. And it's helping rewire their brain, which is going to help with those symptoms as well. Low level aerobic exercise and moderate strengthening are going to be the key double whammy for these patients. So low level walking, so like walking or, cycling or something like that, or whatever exercise that they enjoy, but just doing it at a lower heart rate. So not going up crazy high in their heart rate, just at the lower level of their target heart rate to get them moving. And then moderate strengthening exercises. So obviously we still have to challenge the patient, but we're not going to be maxing out on anything or doing super heavy lifts. We're just basically going to be doing our general strengthening with this patient to help them, feeling better. So that's why a lot of these patients end up liking like Pilates or bar classes. I think those kick my ass, honestly, but exercises like that is also good. And, dumbbells and everything, like any sort of strengthening we can think of, we're just not pushing them through fatigue or overexerting the patient. So this is also why we're incorporating a lot of frequent rest breaks. So they'll do like 3 to 5 minutes of activity and then rest. And that's for like a patient who just started out. So again, not a bad idea. The patients love aquatic therapy. This is probably a population that will love aquatic therapy more than anything else. So they'll like heat in general. So, this is a candidate that you could use hot packs or other, modalities that will decrease their pain. Modalities are also okay, but they love aquatic therapy because it's warm and they can move their body and it's less weight bearing. So it just makes them happy in general. They can get a lot more done in the water than they can on land. And I've seen a lot of patients have really good results from aquatic therapy. So they could start with aquatic therapy and then transition to land therapy, or do like a half and half, 1 day on land, 1 day in the water, because getting them on land is still going to be helpful. But getting them at least in the water a little bit is helpful as well. So the patient's probably on these different types of medications. The most common ones are going to be Lyrica and Cymbalta. And those are, I believe they're in the SSRI kind of category. And then some patients are going to be on other like nerve medications and whatnot. And so basically a lot of these are going to be treating like anxiety and depression, which also have been proven to like decrease some of the fibromyalgia symptoms. So just understanding that these medications can make the patient a little drowsy, a little sleepy, or a little out of it. So just keeping that in mind when treating the patient. But if you see those in their chart, don't freak out. That's pretty typical. So with fibromyalgia, we have our keywords, which include fatigue, rheumatology, so it's a rheumatological disorder, or if they're like, who do you refer the patient to, or what's going on with the patient, or what kind of person is this patient probably seeing? It's a rheumatologist. It's very important for us to know as PTAs, like who this patient's also probably seeing. Like if a patient had like, Parkinson's disease, we want to hope that they're seeing a neurologist kind of thing. You know what I mean? Like we want to make sure we know who are the other people that they're seeing. Now, the PT, their role is to know who to refer to, but we should know what's going on too, at least have some sort of idea. So trigger points, those 11 trigger points of the 18, that's the most important thing to understand about those. So we're going to have pain there, aquatic therapy, great intervention unless otherwise contraindicated, and then aerobic exercise with that moderate, strengthening is going to be good. And then rest breaks are super key for this patient so they don't overexert themselves, similarly to how we do that with our MS patients as well. So a patient is being treated for fibromyalgia following a traumatic accident that occurred 10 years ago involving a near drowning incident, leaving her hydrophobic. Which of the following would be most appropriate for this patient? Well, I guess which exercise would be most appropriate for this patient? 1, high intensity interval training, 5 minutes at a time with rest breaks. Number 2, low level aerobic aquatic therapy. 3, recumbent biking at 65% of max heart rate for 10 minutes. Or 4, heavy lifting at 80% of 1 rep max. So I'll let you guys think about that for a second. All right, friends, so our answer is going to be recumbent biking at 65% of max heart rate for 10 minutes. So this patient is going to be exercising for 10 minutes, which is still okay. That low level aerobic exercise is still okay. Worst case scenario, we can have her split it up into 2 sets of 5. But let's talk about why the other exercises are not going to be appropriate. We don't know if this patient just came in for therapy or if they've been here for a little bit. Maybe they can tolerate the 10 minutes of activity. There's nothing saying otherwise. So let's kind of look into it. High intensity interval training 5 minutes at a time with rest breaks. The 5 minutes is still appropriate for the patient, but high intensity interval training is not appropriate for this patient. They're not a good candidate for that. Low level aerobic aquatic therapy would be great for this patient if she wasn't afraid of drowning. So that's what's going on. She's hydrophobic. She's scared of water. That's a contraindication for aquatic therapy. The recumbent biking at 65% of max heart rate for 10 minutes. That is appropriate for this patient. It's low level aerobic activity, which is going to be good for them. 65% is at the low end of your target heart rate. So that would be appropriate. And then heavy lifting at 80% of 1 rep max. Now, that's going to be a little bit heavy. That's going to be a lot for them. I just came from the gym doing 80% of my 1 rep max, and that was a lot. So that's going to be way too intense for this patient right now. So really, we're going to want to look at that low level aerobic activity. So of all of these, the most appropriate would be that heart rate for 10 minutes. Now, I know some of you guys might have gotten thrown off by the 10 minutes. The big thing with the boards is sometimes they're going to introduce a question that's not perfect for what the keywords are and what they want. But looking at the other answers, you can delete the ones that you know are not going to be good. So high intensity interval training, no. Low level aerobic activity in the water, no. And then heavy lifting, low level biking for 10 minutes, that's going to be the most appropriate out of all of these. So again, sometimes things don't fit perfectly into the mold that we're looking for when we see a question. But again, usually there's enough in the answers that will help you make sure that at least one of them is like pretty much all the way there. I would say if we're looking at these answers, you're like, well, I'd say like this is 75% of the way there. This is like only 20% because it's like too much is too intense. This is 0 because we can't go in the water. And then this, that heavy lifting, not good. So just know that sometimes it's not going to show up perfectly, but you know enough to answer the question correctly. All right, guys, take care. I'll see you in the next one.